Good morning. Hello, Christy. How are you?
Really good, thanks.
So today is the 9th of July, and here in Germany, where I am at, it's a little bit after 10:30 in the morning. I am Laura Maria Caldarone, and this is 14 Days to Change. And with us, we have Christie Lee. And Christie Lee is a 24-year-old law graduate from Hong Kong. Hi again, Christy. So you are our 17th story in this series, but it's actually the second time we have spoken, because the first time we spoke was exactly 14 days ago on the 25th of June. And before we really speak about how things have changed, what's happening in Hong Kong right now, I'd like to show you parts of what we discussed last time. But before we do that, I'm just gonna remind ourselves of the total cases and total deaths that Hong Kong has and had, just so we have that in our mind as we watch the video and as we kick off the interview. So on the 25th of June, there were 1,193 cases, total cases, and there were 7 deaths. Today, there are 1,323 cases and 7 deaths. So that means we have 130 new cases and fortunately no new deaths. So that's where Hong Kong stands as of now. Okay, Christy, I'm going to ask you to go on mute and let me know that everything's fine with the video, because unfortunately I've had issues with this. So you should see, 1 second, why is it not working? Okay. So now I'm sharing, you should see something. And I'm pressing play. Christy, tell us a little bit about yourself.
Sure. I just got out of graduate school and I studied law for my degree and in graduate school, so that I'm going to train as a lawyer in the coming September. So apart from that, so it's really weird that I start with that, because that is such a main part of my identity now. But another thing is that I'm also from Hong Kong and born and raised here, and I really love reading, and sometimes I write, sometimes I don't really, and cooking is one of my favorite pastimes and ways to relax.
And that's always good, because right now it's been a few months that we need some relaxing. So
Yes.
What is it that's happening right now? Always related with the coronavirus, but even more, just tell me what is going on right now in Hong Kong. What are I know things are very different there than in the rest of the world, thankfully.
Yeah.
But just tell us what is on the news. What is the topic that people are talking about the most? What is just give us a look of what is happening right now in Hong Kong.
So right now the hottest topic is about the national security bill, the national security law that the Chinese government is proposing and just inserted into the laws of Hong Kong without going through the proper legislative procedures in here. This is my take on it, but I won't go into too much details, because otherwise this entire conversation will probably be just about me ranting about this, and I want to keep this corona related. So about the coronavirus, the thing is, there isn't much news, honestly, just that they're just really normal-ish ones, like they're just saying that, oh, there are no new cases today, or oh, there are like 14 new, and they're all imported cases, and everyone arrived from like Pakistan or the Philippines or somewhere like that. And then I think there was one guy that was diagnosed in the Philippines, and then somehow he ended up in Hong Kong. I think he returned to Hong Kong, or I'm not sure. But anyway, he went to Hong Kong and he died here. I think that was today or yesterday. And then also a few days ago, there was another old lady who died from coronavirus. So it made the total deaths count to 7. but we haven't had a death case since, I don't remember, since probably around March. I don't really remember because the numbers are so sparse. And um oh a few weeks ago, the government gave out a reusable mask for us, for Hong Kongers, and you have to sign up to get it using your Hong Kong ID and stuff. And then the filter is made of copper or something like that. And you cannot really wash it. You could only take it, you can only like soak it in soapy water and then just let it drip dry or something. So basically, it was something really counterintuitive because nobody would actually have the time to soak a mask that you desperately need on a daily basis
And
into a bucket of water.
yeah, I'm just trying to picture. Explain to me again, what type of mask is it? Made of what, you said?
Oh, it's a reusable mask basically. Yeah, so you know that people, like, if they could get their hands on it, people would use a surgical mask, right?
Yeah, exactly. But this one's not made of. It's what material is it though? I can't
This
picture it.
one is not a this is not a surgical mask. It is a mask that apparently the Hong Kong government designed on their own.
Oh,
So it is made of two pieces of cloth.
okay.
So one is resembling the cover, and the one with the inside. So the inside is like close to your mouth, and then the other one is like another layer on top of that. And
Okay.
in between, there is a filter made with some materials and including copper.
Okay.
And if you also put in the really um ingenious way of washing it, which is really just not convenient for Hong Kongers because we're always needing a mask and we don't really. I mean, like the culture in Hong Kong is really hard for them to like get used to reusable stuff. And if you have to make people use it, if you have to give people a reusable mask that is such a hassle to use, then they wouldn't even bother to use it. Not to mention that it doesn't really look good. And yeah, that was one of them.
Yes, because you
And
said that the way of washing it is a bit annoying, right?
yeah,
You
yeah,
can't dry it, you can't wash it you have to hand wash it and then let it dry drip, right? And
yeah.
mm,
And it's like I personally have been using another reusable mask as well. It was from a UK company called Cambridge. You might have heard of it.
yes, I
And
did, and I even tried to buy one back in February, and they were like
oh,
yeah, sold out.
dude,
And then around in the beginning of March, I told my husband, okay, look, if we buy it now, we'll be able to get it in June. Should I just go ahead and buy it? Nah, whatever, don't bother, blah, blah. And then around April, end of April, he's like, you know what, just go ahead and buy those masks. And I try, and they didn't even have the next delivery. It was like August, and then it
ah,
stopped. And yeah, so I know what masks
oh,
you're talking about. And yeah, I don't have that one.
yeah.
Okay, last question about the masks. If not, it's going to be a mask conversation here. But when when was it that the Hong Kong government provided these masks?
I think it was in May.
Okay, so
But
okay,
but the most serious outbreak was in March when people from the UK and Europe came back.
okay, yeah,
Yeah. So basically, by May, the new cases that we have was probably like less than 10 per week. But when people from the UK came back, it was like almost at least 10 cases every day. So you can see that it's, we would say it's really untimely. And especially with people like just desperately trying to get masks in the beginning of February or in late January when the epidemic was just starting.
yeah.
The mask price rose by like 4 times at least the normal one. So say if the normal price is like 5 to 6 euros for a box of 50, it became like it became almost like 25 for a box of 50.
No.
So it's a really steep surge. And people were just really annoyed at why the government wasn't doing more in January, and you're now only doing that in May. And they also announced that they would be giving out 10 individually, I mean, not individually, I mean, 10 face masks for every single apartment or every single household. So even if even if you're only living alone, then you have 10 masks. But for people who are living in the same address, but they have like 8 people or like what, 5, they still get 10. And this is one of the other. This was announced 1 or 2 days ago, I think, and this is more recent. But people are still bashing the government for just not doing enough.
Okay, so it's a lot of
Yeah.
mask talking lately, but it makes sense because the whole world has been and is talking about masks all the time, whether to wear them, not to wear them, which
Yeah.
ones are they good, not good, what's the point, what's not the point. What are your views as someone from Hong Kong that you have that in your culture anyways, because you've had experiences in the past with other epidemics, so maybe you can even tell us about that. What is your view of the rest of the world, most of the rest of the world, that keeps on debating whether to use or not to use a mask?
Okay. I'll try to keep myself short because the main point is that I believe you should wear a mask to protect yourself and also to protect the people around you.
Mhm.
And I'm the kind of person, like at least personally for me, I'm the kind of person who wears a mask whenever I'm sick, so that I can so that I can prevent people from around me from getting the same flu, flu or whatever that I have. And then for Corona, I mean, okay, so let's go a little bit back to SARS 17 years ago because Hong that was when we in Hong Kong first had a taste of an epidemic, and that was when we realized that masks are actually vital because I think that was mostly driven by fear because in those 2 or 3 months of SARS, I think I don't really remember because I was just a kid at that time, but I remember everyone was so scared of just leaving their homes. It's like they were voluntarily conducting lockdowns within the community. And there were there were at least 7 doctors or nurses or healthcare providers that passed away. And also the infection number was close to 3 or 4 thousand. Okay, now don't quote me on that because I don't really remember the figures. I'll probably get back to you in a bit when I actually read up the numbers. But that was a really hard lesson because like the economy was really bad and everyone was literally afraid of stepping out of their homes. And not to mention that there were some residential complexes that didn't really have the best drainage system. And then the virus spread inside the building with the bad drains. So there were a few complexes that had to be completely evacuated and then revamped because they were literally like harboring the virus. So it made us really paranoid. And with this fear, I think it mostly governed Hong Kong's reaction towards the COVID because we want to protect ourselves the best that we can, especially when there are so many variables out there. And especially when we know that China has a history of concealing up figures just because they don't think that is necessary or just to protect the good image. Some of us learned to distrust China and therefore were a few of the earlier ones to procure masks. Like my friend was the one who introduced Cambridge to me, and
Mhm.
she actually got them shipped here in mid-January. So this is how much she does not trust the official data. And then there are other people who realize that this epidemic is not simple stuff, so they started getting them late in mid to late January when the masks were still at a lower price. I wouldn't say it's the reasonable price, but at least not like charging you 50 euros for a box because that happened.
Mm.
And yeah. So basically I think Hong Kong's reaction about masks and at least mine and also mine I wouldn't speak for everyone, but at least for me, is impulse governed by fear about the for the unknown, because we do not know um how infectious COVID is. We do not know the results, how you would be after you recover, if you recover, and
Exactly.
how was it transmitted. And I think that played a huge part in our reaction. Yeah.
And from what you were telling at the beginning of our conversation, obviously things in Hong Kong in respect with the pandemic, things have stabilized. You barely have new cases, and if you do, they're usually imported cases, but you are still wearing masks. It
Yeah,
is
everyone is.
everyone is, and yes, of course, it was already part of your culture. It was already part of the knowledge that Hong Kong had with the epidemics in the past. But at the same time, it's the knowledge, correct me if I'm wrong, that it really just takes an exception. It takes nothing, that if you don't control it, then you can have another outbreak. You can have,
Exactly.
so yeah. And what about, you mentioned about these imported cases. Tell us a little bit about what is the procedure right now. If, for instance, I would want to go to Hong Kong, do I
Mm-hmm.
have to go through quarantine? Do I have to be isolated for a certain amount of time? Or does it depend what country I'm coming from? Just out of curiosity.
Oh, I can tell you, I can answer that. Definitely you have to go through quarantine, but the exact arrangements would depend on where you're coming from. And I think your nationality or like ethnicity, no, not ethnicity, but your nationality might have something to do with it. Because I think for people coming from Europe or Canada or America, they have to be screened for the virus just after they step off the plane.
Okay.
And they have to be sent to a sort of like a hotel that was changed into a testing center for people to wait for the results, like quick testing with their sputum. And after they're cleared, they have to return home for 14 clear days. And they have sort of like a bracelet with them that they have to, that sort of tracks their location or something like that. I'm not quite sure how it works.
Okay.
And then after the 14 days, you're free. And I also remember reading, like, in February or March, when people from Japan or other places are coming back to Hong Kong, they had to stay in a in a public housing estate that was not yet lived in, and then they converted it into a quarantine center. And everyone coming from certain countries have to stay in there for 14 days before they can leave and return home. I forgot the exact countries, but I can update you about that. And there's actually a really interesting exception with people who are traveling to and from China, I think,
Oh,
that they don't have to go through quarantine, or the quarantine is like shortened. But my memories might be playing tricks on me right here, because I might have mixed it up with the measure in Taiwan, but I'm not sure. I'm sure there's some sort of special treatment with regards to Chinese, with regards to people entering from mainland China, but I'll need to look it up. Yeah.
okay. Well, yeah, I mean, we are so overwhelmed with so much information, different information from, and then you obviously read up on different countries. So the restrictions and everything that comes with it do get a little bit mixed up, at least in my head. So I completely understand. But overall, from what my takeaway is that Hong Kong has been and is quite strict with whoever's coming into Hong Kong, especially if coming from Europe, Canada, or the US. Because you mentioned immediately once you get off the plane, you're checked and then you're taken to this facility. to be wait for the results, and then you have to be home or somewhere. You can't just go out for a drink or walk around.
Yeah.
You have to stay for 14 days. That's pretty strict. And I say this because, as you may know, in Europe, borders are and have been lifted, traveling has started, and many of the countries here do not have a quarantine. Some countries ask for some type of document that says that you have been tested a certain amount of time before. Others don't. So there isn't this thing of you have to be quarantined for 14 days and checked. Some countries do have it, but most don't. At least the plan right now is not. And as I can see from your face, from your facial expressions, you are in the same, you have the same worries as a lot of people in Europe have, that it is not good, especially because, as we've seen, cases are still happening all over the world, but also in Europe. I don't know if you read, I can tell you a personal experience, something personal that has happened here in Germany. In the area where I live recently, there's been an outbreak and obviously, because there's the fear that the virus has spread, there's around 400,000 people that have been brought in lockdown again, and they're tracing and seeing and testing where has the spread gone. So this is Germany that, as you may know, Germany has had one of the best responses in the world, not the best, but one of. And if it happens here, and it's still happening here, this started happening like a week ago, so it's very recent, and the lockdown happened a couple of days ago, very recent. From your facial expressions, I see that you are thinking, what are you doing? Am I right?
Honestly, yes. I would like to talk a bit about the government's response and about the borders in a bit, but my opinion on what the European countries are doing are that, are you out of your bloody minds? I'm okay with you opening the borders because there are people who need to travel, but if they need to travel, shouldn't you make sure that your country is safe from any incoming cases? Because otherwise, I would think that you're you're trying to, what's the word, to binge on the opportunity to to bank on the chances that the people coming in or have somehow been under self quarantine or lockdown for the past whatever months, and they're never infected with the virus, or they're fully recovered, or whatever that is.
And that
Which I
on their
think
way
is,
to the airport, because also that on their way to the airport, they didn't get infected, right? In the flight and so on. Yeah.
so I think that was a rather brave policy, I would say. And I seriously remember people talking. There was an Italian pizza place in Hong Kong, and the owner spoke once about the coronavirus pandemic and how it is in Italy because he heard it from friends. And people actually praised Italy once for stopping all flights to and from China, because China at that time was the epicenter of the entire pandemic. And that, okay, so I thought it was really smart until he said that they're stopping all direct flights from China to Italy only. And I was like, wait, but people in China don't really get to travel internationally with direct flights that often, so they're usually flying on transit. And they're not stopping any transit flights that somehow end up in Italy. So, I mean, I can't fault the logic. And it can't exactly like stop anyone from going inside Italy, because that would be really draconian. I don't think this is how the Italian government works. But that shows in parts the ignorance that I see in some of the government leaders. And I can't say I'm not disappointed.
I mean, it's funny that you mentioned this about direct and not direct flights, because indeed that was the situation, not only with Italy, but with other countries. For instance, when the US did the travel ban from China at the end of January, and then it really began beginning of February, it was the same thing. When I first heard of that, I thought, okay, but you're talking about direct flights. What if someone is just, going to Paris for a couple of days and then traveling to the US?
Not to yeah, not to mention Hong Kong is actually a very popular place for them to go in transit because Hong Kong has a lot of okay, except for okay, so Hong Kong has direct flights for many countries except for Europe because I think there was only like for example, I think there's only one direct flight going to and from Vienna to Hong Kong.
Mhm.
And the same for Rome and France. I don't think it's even any direct flight for Rome, but there is only like one or two flights per day going to and from Rome. So say like even if we're in Hong Kong, we would fly transit, and not to mention people in China who have a more closed off airspace, and not to mention they have more difficulties in traveling because the last time I heard they have to somehow prove that they are of good standing and have enough money before they're allowed to leave the country. But I'll leave it at that because otherwise that would turn into like what a politics discussion. But then actually I want to talk a bit about the borders in Hong Kong and it how Hong Kong gradually closed off its borders because that is actually a very interesting phenomenon that we see and
Mhm.
something that we still constantly berate the government for. So when the first cases started appearing in Hong Kong in mid to late January, people were already saying that do not trust China because it was starting at the fish market or something in Wuhan,
The wet
and
market
then
in Wuhan.
the wet market, and then like it just spread like wildfire from there. And then people were saying that, okay, so you do not have to only stop entry from people from Wuhan because people actually move around the country. If, in case you're not aware of that, people have legs and they're trains and stuff. So, and especially when it was almost time for Chinese New Year, there's one thing in China that's really common. It's called Chen Wan. So a direct transliteration would be like a spring transit. And it's basically where
Yeah.
sort of migrant workers, they move from city A to city B for work for the whole year, and then they only return home for every single Chinese New Year. So this is a massive transit going on. And then by the time Wuhan closed up its own borders in, I think it was,
23rd of January.
yeah. And then people were already like frantic because Wuhan is no longer the only epicenter because people carrying the disease have potentially spread to other parts of the country. So at that time, Hong Kong was only stopping all trains because we have trains going to and from China, which personally I don't agree with, but whatever it happens, it is like that. So they stopped all trains going directly from Wuhan to Hong Kong. And then people started pouring in, no, not pouring in, but cases still continue to rise in Hong Kong because people still come in from mainland China. And the cases then we see are not only limited to have an origin in Wuhan, and then we were rightfully angry because this is still the beginning of the epidemic, but it's clear that the source is from China, from mainland China. Now, I do not mean any like disrespect or something in case some people would attack me for being like attacking mainland Chinese or something just because I'm from Hong Kong. But the fact is that, and then there were medical professionals in Hong Kong. They were going on strike for every single public hospital. They went on strike and they formed a union just so to pressure the government in closing of the borders of China.
When was
Because
this?
to the strike,
Around
I think the strike was probably in like late January to early February. It all blends together. I honestly forgot. and also because like sidetracking a bit, um I was in a voluntary quarantine during that period because someone in my apartment building was diagnosed. But so that might be also why I was really like jumbled up on details on those days, but whatever. So the medical professionals, the doctors and nurses, and public hospitals went on strikes, and there was massive controversy around this because they were like saying, "Oh, you're a doctor, shouldn't you be saving lives?" And but then the doctors are like, "Oh yeah, we are doctors, but also humans. But and do you want the government literally killing us just because we do not have enough masks, we do not have enough protective gear. They're providing outdated equipment for us, and the masks that are like thinner than sheets of paper."
So Hong Kong basically had the same problems as the rest of the world. As you know, I don't want to say the whole world, but most of the world, most cities, most countries, most governments, and obviously most hospitals had that exact same problem. They didn't have enough
Yeah,
protective gear. There were no ventilators, or not enough ventilators, not enough ICU beds or departments, not enough nurses and doctors also, right? Okay, so it's interesting to see that although Hong Kong had lived through a big epidemics, and obviously is and has been more aware and has been lucky. Well, it's not luck, right? Because you have to put your own
yeah,
energy, and you really have to put your own part. It's you still have, or still had the same problems that we've had in Europe, we've had in South America, in Asia, India is having right now, Brazil is having, and the United States, right? In states like Texas.
yeah,
Okay, yeah, we're all the same in the end.
yeah.
Yeah.
Because one thing I see about Hong Kong is that we just encountered the shortages in healthcare resources earlier on in like January or February, and coupled with the social movements in the past year, quite a lot of medical professionals were incensed by what the government was doing or the lack of action. So the only way that they could see to protect themselves was to go on strikes, because if hospitals go on strikes, then shit gets real, excuse my language. And then so I think I was just 1 or 2 days after the medical professionals went on strike, and then the chief executive announced to close off all borders that allow entry, direct entry from mainland China, except for 2 channels. I think they closed like 4 out of 6. But people were complaining that it was not enough because people would still find some ways to go into Hong Kong in those by those methods. I think at that time there wasn't even like a mandatory testing system for people arriving from the airport, so they could pretty much just roam free. The mandatory testing was introduced a bit later, so there was quite a bit of public outrage at that. And so I would say that that was actually the first steps that the Hong Kong government took to actively stop the virus from spreading. But personally, as someone who has lived through both pandemics, I honestly do not see this as the most effective thing that they should have done.
You do not.
Do not.
Okay. I mean, in general, the pandemic is a very difficult topic to discuss. There's too many opinions from one side to the other, too many studies that support both sides, too many examples that contradict the other side. So I think this is my personal opinion. The only thing we can do in order to see what was done well, who did it well, is aside from learning as we go, because we need to, the
Yeah.
final judgment will be done once the pandemic is really over and people really looked into each action and inaction from the different governments. And really
Yeah.
have the lessons learned then. But again, it is important to, even right now, look at the different countries, at the different actions, and learn as we go, not wait until everything passes, because then it will not pass, right?
Hmm.
Tell me a little bit about what are your hopes? What are your concerns? What do you think is going to happen in the next few days, in the next few weeks, with the pandemic in Hong Kong, in China, in the around the world? What is it that you don't want it to happen? But just tell us a little bit about your thoughts about the coronavirus pandemic. What are your hopes and what are your concerns?
Honestly, right now, all that I can think of is that I hope this coronavirus is over as soon as possible. This is my only hope right now for every single place in the world. And my concern is that with the borders opening up in Europe, there might be a second wave of outbreak, which I'm very concerned about. And for Hong Kong and mainland China, I think like the one thing in common is that I still want the coronavirus to be over as soon as possible because it's really taking a toll on a lot of things in life. And as to concerns about Hong Kong, I'm not sure if the anti-gathering rules are going to continue.
Do you think
And
they should or that they shouldn't, based on the virus? Or do you think that Hong Kong is in a place that it's stable enough that it doesn't really need them?
I can't tell because there are actually more cases recently than I've been used to seeing for the past few weeks. So
The,
I'm hoping the number would go down.
mm,
It's like there was a period where there are no cases for maybe a few consecutive days. And then if there is a case, then there's only one new. But then now, at least in the past week, there are like 2 or 3 days of like 10 or more cases. So I still cannot tell whether the rules will continue or there will be more stringent ones in place. And as for me in China, since I don't know, um, I still want the pandemic to be over, but I can't really say what I'm concerned about them because information are not exactly the most readily available.
transparent.
So yeah, it's not as transparent. So I'll just say I hope this second wave that we know of in Beijing are going to be resolved very soon.
Yeah, that has been a concern. You
Yeah.
gave your thing, your concern, and what you hope doesn't happen. Yeah, it's basically the same hope everywhere and the same concern everywhere, right? You just said in Hong Kong, there's been a couple of more cases than usual. In Europe, and let's clarify, it's not only Europe that is opening the borders and is going to start and has started traveling in and out. You have the same thing in South America that it's going to start and it's starting. You have in small islands around the world also, and in Asia. So it's the whole world that little by little is opening their borders. And
Oh
yeah.
yeah. Oh yeah. I just want to add one thing about the charity match in Croatia, I think. Novak Djokovic organized a charity tennis match in Croatia, and then it turned into a mini outbreak. And then quite a few tennis stars were infected, including Djokovic himself. So one of the other things that I'm hoping for is that people actually know the importance of protecting themselves and others, even when you're trying to
Too good.
maintain solidarity within the community. And just please get well, people. The tennis world would the tennis world would literally suffer without these people.
Yeah, yeah.
And I hope they've learned the lessons because I mean personally I have been wanting to watch the French Open originally held in May, but now that with the coronavirus, I don't even know if it will be on in September, and even if then if I'll be able to go and watch it. And just like, I don't know, I can't really articulate my thoughts right now, but these are all I have. Basically, like best wishes, and I hope everything will be over, and whatever new outbreaks that we see will be over soon.
Yeah, and just be careful. And just like the example that you gave with Djokovic, and even if you want to do good, remember that doing good, that the pandemic doesn't care why you're gathering. If it's to have a party because you feel like it and you're selfish, or if it's because you are, doing a charity and bringing people are putting money in order to help a orphanage. So good or no good, the pandemic cannot tell the difference and doesn't care. So be careful with the gatherings, do social distancing, just think about the others, think about yourself. And it was a very good example. 2 nights ago, I think, or last night, I heard my husband, a friend of his, had called him and saying, Djokovic, he has
Yes.
it. So it was a big deal. It is a big deal, and it just shows that no matter how good your intentions are, um, you have to be more cautious in this pandemic. No?
Yeah.
Um, to finish, because it has been really a pleasure speaking to you. There were so many things I wasn't aware of, I didn't know, and it has been very, very interesting to see and hear your thoughts on the coronavirus, the situation in Hong Kong, and now your hopes and concerns, and your little message to everybody, right? And also your feel good, Djokovic, get well soon, right? Um, if you could give a message to Christie, the Christie that is going to be here in 14 days, so your future self, what message would you give her?
That's a hard one. Um, Probably like just chill and relax as usual. I don't know. Because honestly, with regard to the pandemic, I think I'm doing already the best I can. Like I'm not freaking out every single moment about any possible outbreaks. I'm just taking it a day at a time. And I think I would like to tell my future self to continue on that in case I have a panic attack on whether things would turn bad or something. Yeah.
Okay, so Christie, take care of yourself and relax. Just be cautious,
Hmm.
relax, and take care of yourself. That's a very good message. And I think we should all really think of that. And we need to be able to be careful, but relax and
Hmm.
just take a deep breath every day and just keep on going forward. Christie,
Yeah.
again, thank you very much for your time.
Thank you.
It has, not to sound repetitive, but it really has been a pleasure talking to you. We have spoken a lot
Same
because,
here, Laura.
and I
Yes.
and I really think we could just speak more, but let's stop.
Yeah.
Let's stop it here because, anyways, we will see each other in 14 days.
Yep.
So, Christie, thank you very much, and I will see you in 14 days.
Yeah, sure. See you.
Thank you. Bye. So, Christie, this was just part of what we spoke about. So big pieces and big bits. And some people may think, oh, it was too long, but it was really all so important. And I would have put even more, but
Hmm.
so many of the things are so relevant for what is going on right now with, with the traveling, with still the fact that people are still debating about masks, whether to wear them or not. Before we really start talking and clarifying and just continuing and just, seeing how things changed, I just want to ask you, what were your impressions? Because it's the first time you see the video. It's the first time that you hear your own hopes and concerns of 2 weeks ago, and even the message to yourself, right?
I think I needed that
Yeah.
because with the way that things are going, with the corona related or not, as in like with the situation in Hong Kong right now, we really need to chill. And I like to think I'm doing an okay job at it, but I don't think I really am, because all that we can think about is it's a very genuine concern that we might be the next people who are being arrested just for something irrelevant or something that we didn't even technically do wrong in the eyes of our profession, or just like maybe a Facebook post or something. It's chilling. And it's more like it's not the law itself that is horrifying, it's the implications that come with it that it's very hard to come to terms with all the implications. And you add in the new outbreak right that we have here, and the
It,
most that we can do is to keep calm, I think. Yeah, I'm trying, but it's hard.
exactly, because like you mentioned, yes, the pandemic is there. Yes, there's so many things that keep on happening, just, day after day, new things, the same things. And obviously the pandemic is affecting many people in different ways and many things, but at the same time every country is still having their important events, their things that change their history, their situation, and in the instance of Hong Kong, it's this national security law. It's been 1 week that it has passed, and your reality is living through this, coming to terms with it, understanding, disagreeing, agreeing, just figuring life after this, whether you're for it or against it, like it, don't like it. And on top of it, you have, we discussed at the beginning of our conversation, you have had a spike. You have 130 cases, which for some countries and some people may be little, but not for Hong Kong, considering that you barely had any cases since the beginning of the pandemic. And then, as we saw when you spoke, it was one case here, maybe two cases here, a week without cases, and now 130 cases.
It's a lot to take in. And the timing is quite interesting as well, because the spiking cases came approximately 2 weeks after all schools are open, and the cases were all confirmed in the beginning of July. So people have had speculations as to different theories behind that. I don't want to go into that too much, because this is supposed to be the facts of Corona instead of me adding too much of my views. But I've noticed that because in Hong Kong, there are quite a number of students who are born in Hong Kong or something. Just, I mean, they're entitled to go to school in Hong Kong because of their residential status or their citizenship or something like that. But they mainly live in mainland China. They have to do a daily commute from China across the border to Hong Kong just to attend school. I mean, it's a long journey, yes, and they're not those cross-border students, as we call it, are not subject to any quarantine arrangements. So they're basically transported directly from the borders to the school. And there have been reports that since the school opened, these cross-border students have reported cases of fever, of like severely high fever. I'm talking about 38 degrees in Celsius or above, and they're still allowed in school. People have complained, and it is very unsettling, I say, to see these people just coming to and fro when travelers have to undergo quarantine at home or at a designated housing or at a designated quarantine camp, but they can just come and go if they wish because they're just going to school. And then just so happens that 2 weeks later, after the schools fully reopened, there are spiking cases. There have been, like you said, there have been around 130 cases in the past 1 or 2 weeks. And I can't help but link them together because I don't want to go too much into it, but the situation about these these 100 and something cases are that they have a very wide network. As in, there might be one student infected in school A, and then their parents visited another restaurant with them, and then that restaurant has another patron who is a student of school B, and this network just expands and expands. And one thing is that there has been a cluster of cases in one nursery home for the elderly, and which brings me to a new lockdown arrangement in Hong Kong. I previously mentioned that so I previously mentioned that Hong Kong relaxed its sort of lockdown arrangements after restaurants are allowed to host patrons at a higher capacity. Before it was limited to 50% of what they're legally allowed to. So say for a restaurant was legally licensed to host 100 people, they can only host 50, and each table has to be partitioned, or there has to be a 1.5-meter distance between them. It was relaxed, and in the very beginning, there were only 4 people allowed per table. It was relaxed to 8, and then 16. And as of today, yes, a new announcement came out just not 2 hours ago by the press release. It's a press release by the Health Department and the Center of Disease Prevention. It's basically the government bodies that is in charge of managing COVID and making these announcements. They are now saying that firstly, the number of restaurant customers should not exceed 60% of the legal limit. So with the example just now, the limit is at 50 people, and the maximum amount of people allowed at one table is 8. And if you're at the top, then you can at most have 4 guests at one table. And then you have to still have your temperature taken when you go into the. And then for gyms, basically like entertainment facilities like gym or a party room or a karaoke.
Yeah.
And the limit is restricted to 8 people per room. And for nightclubs, the maximum capacity is capped at 60%, with a max of 4 people per table. And you cannot eat inside cinema.
So what this really does is show us, you guys were opening, you had things that you were easing, restrictions that you were easing, because again, it's all about what situation you're from. So we hear about cinemas, that you can't eat in cinemas, but in some countries there are no cinemas. And that's because the situation in Hong Kong from the beginning was different than the situation in another country, and is different right now. So you're easing the restrictions, but already what was there was less, let's say, than other countries, right? Because of the response, because of many factors. And, but again, even though Hong Kong is an example in the world of how well they responded, acted, and reacted to the virus from an early time, right? Because it's not only about how you act, it is about when you act, because you can act very well, but if you wait a year, those actions, it's really difficult, right? Or some even may say, I don't want to say impossible, because it's never too late in a pandemic, right? But it's more difficult. And this shows that, you, Hong Kong, cannot let your guard down. You need to keep on looking and being cautious and doing all the different measures. Just like look at Australia. Australia also an outbreak. Melbourne needs to go on lockdown for 6 weeks, things changing and so on. It's difficult. I want to get back to one thing that you mentioned, because it's a very hot topic right now in many countries, especially in the United States. And the United States, unfortunately, it's an example not to follow, because it's just been really sad to watch. Right now, currently in the world, we have almost 12 million, a little bit above 12 million cases in the world. And there's a little bit over 550,000 deaths. And in the United States alone, we are talking about a little bit over 3.1 million cases and almost 135,000 deaths. So the US has been hit very hard. And one of the things that they're looking into doing is schools, opening the schools in August, in the fall. But there seems not to be a very comprehensive, coherent, and strong plan of how to open the schools. You know, what happens, because you just mentioned there's some cases that also are very related. You know, parent from child of school A went to a restaurant with the children where student B was, right? And this is you already have measures in place at your schools. Can you tell us a little bit more of what these measures are, just to show that even in a country with a very good response, with measures already in place, you have situations like this?
Okay, I'm actually not too familiar because I only have friends teaching in primary schools, and I haven't really talked to them about the arrangements. But what I heard is that the desk at school, they have to be separated by around 1 meter or 2 between students. So they are basically sitting on an island on their own. And then school hours are shortened to only half day, because in Hong Kong most schools are run on a full day scale. And then due to COVID, they shortened them to a half day. And they're also suspending some classes, like physical education, I think. So people won't have to gather at the same place at the same time. And they have to take their temperature when they go to school. I think that's it.
What about testing?
I think there might be, sorry?
What about testing? Do you know about testing?
I don't think schools have to force students to, I don't think students have to take tests before they are allowed back.
But see, again, we need to emphasize it is two things. You speak about not knowing very much, like the details, but you know the basics. So temperature, social distance in the class, masks, right? Yes. Masks, so masks, social distance, temperature in the class, some classes suspending, and shortening hours, right? You say, yeah, these are the basics, but the details I'm unsure of. These basics are basics to you, but there are actually things that are not happening, are not even thought about in other countries. So it's perspective. And the second thing is situation. These are basics that it's the minimal thing that Hong Kong needs to do, and is doing probably even more that now or later, or is planning to. And the situation is that Hong Kong has 1,323 cases and 7 deaths. And this is the plan. This is what is happening right now. And you have countries like the United States where these things are not being planned. They're not happening. They're not thought of. It's like, yeah, we need to open the schools, which of course you want education. Of course you should open the schools, but it's about how, right? Your example of student A, student B was sadly quite perfect to show what happens. And also you mentioned students coming from mainland China, right, to go and attend school in Hong Kong. And they're crossing the borders, and it's difficult. They're not doing quarantine because they're going to class and so on. But it's the same situation. You take out the borders, and it's the same situation in any country. You go from neighborhood A, which is in city A, to neighborhood B, which is in city B. And the situation is different from one city to another. And you can bring the virus.
Yep, you're very right.
So it's perspective and situation. No?
Mm-hmm.
It's really interesting, but watching again the video where you remain like your face completely changed when we were talking about the borders and the non-quarantine and all these things. and it makes me think you were right and you are right, because we're seeing spikes, right? And we're seeing in Spain, there's areas that are being closed. You have in the UK, other areas that are being closed. You have countries that are saying, hey, UK, you can't come in until the 15th, like Greece, but after the 15th, they can with no quarantine. It's difficult.
Mm-hmm.
Difficult. Anything you want to add about what you are thinking about your situation in Hong Kong, or what you're seeing around the world? We spoke a lot about masks, because again, they're still being, do we need them? Do we not need them? How can they protect you? They don't really protect you.
I think my perspective on the mask hasn't really changed. But one thing I would like to clarify about the quarantine arrangements about incoming people to Hong Kong is that I think I made a mistake in the earlier interview. I think the right thing should be, just let me check. Okay, so firstly, non-Hong Kong residents, if they come from overseas countries by plane, they cannot enter Hong Kong. And then non-Hong Kong residents, if they come from mainland China, Macau or Taiwan, and they have not been to other regions in the past 14 days, then they can be allowed to enter. And then for China, okay, so the non-Hong Kong residents that come from China, mainland China, Taiwan, or Macau obviously include mainland China residents. And okay, so that was the entry restrictions into Hong Kong. And then if you come in, okay, and then if you're an inbound visitor, if you're coming through mainland China or Taiwan or Macau, then you will have to be quarantined at designated quarantine camp. But if you're a Hong Kong resident who come in by plane directly, then you will be subject to a compulsory quarantine, but you can choose to have your quarantine at like a hotel or your home if you live here. So this is one clarification I want to make, but you still need to be quarantined. So
yeah. So it's about where, but the quarantine needs to take place. And you mentioned it in the video, because Europe and a lot of other countries in the world is banking, that's the word you use, is banking on thinking that whoever is coming has not been infected. It's a lot of Russian roulette playing. So, Christie,
yeah,
it's really difficult, and it's difficult and interesting to see the differences and the similarities. It's still interesting to see that, no? And even after 2 weeks, after 2 weeks, your hopes and concerns were that it doesn't go up, and you were telling me, yes, there's 130 cases, and you gave some examples of some of them. It's all of us. Christie, I think we can continue talking, but I know you have to go. And it's also getting long, the video again. And we know that people's attention span, rightly so, with social media is lowered. And we want people to watch this and understand the differences and learn and get inspired and help each other, right? So on that note, my last question to you is, in the first interview, I had asked you to give yourself a message. What would you say to the future Christie? Now my question is, based on this experience you have had with me and 14 Days to Change, based on how things have changed since our first conversation to today, and just the pandemic in general and your life right now in general, what message would you give to the people that are going to watch this? What would you tell them, regardless if they're coming from a country or a situation that is worse off than Hong Kong or better off?
Stay vigilant. This is all I can think of right now.
Stay vigilant. Well, it's actually short and sweet, but very, very true, as we've seen, right? Perfect. So stay vigilant, and Thank you very much,
Stay
Christy.
safe.
Stay safe,
Thank you,
stay
Laura.
vigilant, and thank you very much. Have a good evening.
Thank you. Thanks. Have a nice day.
Bye-bye.